How does a visual field test detect blind spots from neurological conditions? Imagine trying to see the world around you while focusing on a single point in the center of your vision. A visual field test works like a detailed map of what you can see in your entire field of view. It helps doctors find blind spots that might be caused by neurological issues like strokes, tumors, or nerve damage. The test shows where your vision might be missing or less sensitive, which can reveal important clues about your brain and nerve health. During the test, you sit in front of a special machine and focus on a central target. Small flashes of light are shown at different spots across your visual field. Your job is to press a button whenever you see a light. The machine records where you see the lights and where you don't. If you don't see a light that should be visible, it suggests a blind spot or a reduced sensitivity in that area. This process helps create a map of your visual field, highlighting any areas where your vision is affected. A key part of the test is finding your natural blind spot, which is a small area in your vision where your optic nerve connects to your. The nerve has no light-sensitive cells there, so you cannot see anything in that spot. The machine shows stimuli in this area to confirm you cannot see them, which helps ensure your eye is fixating properly during the test. If you respond to stimuli in your blind spot, it might mean your eye is moving or the test isn't reliable, so the results would need to be reviewed carefully. The test also tracks your eye movements to make sure you keep looking at the central target. If your eyes move too much, the results could be inaccurate. The device uses special monitoring tools, like gaze tracking, to watch your eye position and make sure you stay steady. The results are then compared to normal data to see if there are any abnormal areas. If there are, it could mean there is damage somewhere along your visual pathway, such as from a stroke or a tumor affecting your brain. The results are analyzed using statistical measures that show how much your vision differs from what is expected for your age and health. These include numbers that tell doctors whether the blind spots are small or large, and whether they are spread out or concentrated in specific areas. This helps doctors understand the pattern of your vision loss and determine if it's related to neurological problems. In cases of neurological damage, the pattern of blind spots can be very telling. For example, a stroke affecting certain parts of the brain might cause specific visual field defects that help pinpoint the location of the injury. The test results can distinguish between damage to the eye itself and damage to the visual pathways in the brain. This information is crucial for planning treatment or further testing. In summary, a visual field test detects blind spots caused by neurological conditions by systematically mapping your ability to see light stimuli across your entire visual field. It identifies areas where you cannot see stimuli that should be visible, and it uses fixation monitoring and statistical analysis to ensure the results are accurate. This helps doctors understand whether the vision loss is due to nerve or brain damage, guiding appropriate diagnosis and care. Always remember to consult with a healthcare professional for personalized advice and interpretation of your test results.